What is endometriosis? In the woman uterus, there is a soft lining. We call them as a endometrium lining. This lining becomes thick every month to prepare woman for pregnancy. So, because that layer of endometrium lining helps if any implantation is going to happen. So, if in case pregnancy is not happening, this lining shed, break down, and bleed from the vagina, and we call them as a menstrual period. So this is the work of endometrium lining. In case of endometriosis condition, this endometrium lining grow outside the uterus where it should not be. And which are the most common area where it grow? It found mostly on the fallopian tube, on the ovary, the tissue that holds the uterus, and the outer surface of the uterus. And this endometrial tissue, which is growing outside the uterus, it works in the same way how the uterus lining works. So if the pregnancy is not happening, this endometrial tissue becomes thicker, shed, break, and bleed. But as this lining has no way to go out from the body, it causes inflammation and pain to the woman and cause issue while getting pregnant as well. And when this tissue growing on the uterus, and it every month bleed, so that trapped blood form a dark brown color cyst, and we know as a chocolate cyst. Doctor sometimes says as a chocolate cyst or endometriosis. So this is all about endometriosis. Now, what are the symptoms of endometriosis? Pain is the most common symptom to the woman who has that endometriosis condition. But pain could be different type. Women can feel many different type of pain, like very painful menstrual cramps, long-term lower back pain or pelvic pain, or pain during the intercourse and after intercourse, and again pain during the bowel movement, during the urinating, especially at the time of menstrual period. Some stomach problem also women can feel, like bloating, constipation, diarrhea. It makes harder for the woman to get pregnant. So this is the most common symptom in women who has this endometriosis condition. So why does endometriosis cause pain and health problem? So as we know that when this lining, endometrium lining, growing outside the uterus, and it get bleed every month, so this form a scar tissue, and this tissue grow and continue to expand and create some problems to the woman, like it can block the fallopian tube and changes the shape of the organs or pelvic, and it make harder for the sperm to find the egg. And again, because of this scar tissue, it is harder for the woman to get pregnant. And again, it impact on the immune system, the faulty immune system, unable to find and help to defeat the body against the disease. Once again, it impact on the nearby the organs. So these are the problems it cause if the women are having this condition. And how common endometriosis is? Endometriosis is common health problem in the woman. So it estimated to affect approximately 10 to 15% of the women of reproductive age worldwide. Now, who gets endometriosis? Endometriosis can happen to any girl or woman, but this is more common in women who are in their 30s or 40s and who never had a children. So researchers are still looking at a possible cause. Researchers think endometriosis might affect as many as 1 in every 2 women with infertility, and the woman whose menstrual cycle is less than 26 days, or woman whose menstrual period lasts for more than 7 days or less than 2-3 days. This could be another problem. And again, any family history of endometriosis, so it may inherited in the gene itself. Again, the health problem that blocks the normal flow of menstrual blood from a woman's body during the period. So these are the reason if the woman might get endometriosis. So, what causes endometriosis? No one knows for sure what causes endometriosis. Researchers are still studying the possible cause, which may include that problem with menstrual period flow, retrograde menstrual blood flow. Is might be the cause of endometriosis. Some of the endometrial tissue said during the period flow. It goes through the fallopian tube into the other area of the woman body, such as pelvic, and this could be the other reason. Then immune system, which is the faulty immune system, unable to find and destroy the endometrial tissue. And again, estrogen hormone appears to promote the endometriosis. Researchers are still studying whether endometriosis is the problem with woman body hormone system. Surgery could be the another reason, that during the nearby the abdomen area surgery, that endometrial tissue could picked up and move by mistake nearby the area. For instance, that endometrial tissue has been found in the abdominal scar. So these are the reasons which can cause endometriosis. How is endometriosis diagnosed? There are many ways to diagnose endometriosis. So doctor may suggest for few examination. First, they will try to consult you. They will try to ask everything. Examination, let's say for example, they can suggest pelvic examination, imaging test, and last is the laparoscopy. During the pelvic examination, doctor can feel the large cyst or a scar behind the uterus, but the smaller area of endometriosis would be harder for the doctor to find. So, suggest for imaging test, for ultrasound. So, ultrasound, again, that there are two types, that 2D and 3D. So 3D gives more clear picture. It's doctor choice what they are recommending you to do. So they can predict something, whether really there is a cyst or something suspicious like endometriosis. If the doctor is unable to figure out or conclude, they might suggest for MRI. MRI can give a good image of organs or tissue, and it can help doctor to conclude. In case still doctor is not very sure, they can suggest for laparoscopy, and this is the last procedure to be get sure if the female has that condition or not. This is one kind of surgery, so that doctor investigate, doctor see nearby the doctor look into that pelvic area and try to see if the endometriosis tissue is present or not. And this is the only way to find and to be sure that woman has this endometriosis condition. So these are the way to diagnose the endometriosis condition. How is endometriosis treated? How could we treat the endometriosis? So there's a no known cure for endometriosis, but symptom and the problem which causes can be treated with the help of the medicines. For the doctors, hormonal birth control is the first step for this condition. So doctor, if the woman is trying to get pregnant, so doctor may suggest after the surgery to take gonadotropin releasing hormone, that is GnRH agonist medicine. So basically after taking this medicine, it would be temporary menopause for the woman, because it stops the menstrual cycle of the woman. And so once she will stop taking this medicine, her menstrual period again, it will return, and then woman would have a better chance to get pregnant after the treatment. If the woman is in the early stage, that it's not causing a lot of pain, but still somehow doctor has found that woman has this condition, doctor can suggest to go with this hormonal birth control medicine, that is GnRH agonist medicine. Her menstrual cycle will get stopped for a few months until she is taking. So usually it will not come immediately. It will take 0 to 3 months for the woman to get her periods. It will not come immediately. Once you stop next month that you will get a period, don't expect. Yeah, so but after taking this treatment, woman can have a better chance of getting pregnant. And surgery is the last approach when a woman has a very severe pain due to this condition, and it is not she is not getting relief from her pain, or due to infertility issue, woman can go for the surgery. Doctor can locate that area in pelvic, and doctor can remove all the patches of endometriosis tissue. Doctor can clean that area. Doctor may suggest to stay on the medicine for maybe 2-3 months again, so that area should get healed properly. Also, doctor may suggest some pain medicines like ibuprofen and naproxen, and just some supplement like related to vitamin B1, and again magnesium and omega 3 fatty acids. But these are the way to get treated for the woman if she has surgery. So if it is a early stage, a doctor suggests to go with the directly medicines, or if it is a very late stage, female has a very severe pelvic pain, then doctor suggests to go for the surgery and then again plan for her pregnancy. People has question that does endometriosis go away after menopause? So yes, for most of the women, endometriosis go away after menopause. The painful symptom of endometriosis get improved after menopause, which occurs in the age of mostly 45 to 55 to women, because body stops making the estrogen hormones and the tissue also get shrink. That endometrial tissue also get shrink slowly, and due to that women won't feel symptom of pain or anything else. Now people has many questions that can woman get pregnant if she has endometriosis? Yes, woman can get pregnant if she has endometriosis, but it make it little harder for the woman to get pregnant. Endometriosis might affect as many as 1 in every 2 women with this infertility issues, and which includes, like for example, patches of endometriosis blocks the fallopian tube, it changes the shape of the organs because of a recent, so and somehow her reproductive organs get impacted, so it is harder for the sperm to find the egg. And again, the immune system, which normally helps defend the body against the disease attacking on the embryo, this could be the another reason. So the endometrial, the layer of the uterine lining where the implantation happen, it does not develop as it should be. So these are the reason causing infertility to the woman. I would like to say whatever I have shared here, it's based on my knowledge, which I have read some article, and these are the links which you can see on a screen, and you can go and further read and have a deep understanding about this condition.